Yes, welcome everyone to the channel. The topic is still going on. I think we'll finish it today. We will finish this topic today because it was a request, and a request topic should be finished because people want to understand so well about what is happening. So we talked on menopause and menopausal syndromes, and you remember the physiology, how it comes about. We do some figures, and you saw how this thing is excited, and how it comes, and then it turns out to be a multitude and a cascade of events. It is from somewhere, and the place that this thing comes from, you understand, is from the follicles. It's from the follicles. When the follicles wither, there are some hormones like estrogen and inhibin that are not produced as it's required. So it leaves some hormones from your brain, like follicle stimulating hormone, and other hormones like luteinizing hormone. They come and they overpopulate your body, and then you start having hot flashes, and then it goes like that because the more that some hormones come to your body, the more you have some effects that are not well. We talked about serotonin, dopa, and GABA, the pleasure hormone, which is which is dopa, and then serotonin, which is mood stabilizer, and GABA. Those are hormones that are also is not stable when you have problems in your body, and that is why you have the problems that you have when you have these issues that we get. Now, we have so many issues when it comes to management. And we saw the critical part is not even the menopause itself, but the critical part is the premenopausal part. Because the premenopausal part is whereby this is where you start having the crisis of having issues with your body, the crisis of having hormones that are fluctuating, and crisis of having everything that is going up and down, premenopausal. But today, we want to deal with the principles of management, because now we know that it's not you yourself that wants to ignite what is happening, but it comes out as physiological. It comes out as physiological. So please, as we go through the management, this one today, we will not talk about it again. But if you have a question about it, about menopause, premenopausal, and menopausal syndromes and management, you can always come privately and ask, but or ask below the video itself. Now, we deal with the management, the principles of management of these conditions. How do we go about it? The principles of management of health, in health management of menopause, has three pillars. Three pillars. Wow. Now, Tulips Corner here. Welcome, Beauty Simba. Welcome, and everyone. I think yesterday we had a problem when it came to network. But today, I see network is good and we are interacting well. If you just have a question, drop it on the bar and then we can discuss it. So many people here can help you to understand what you are not understanding very well. Tulips Corner. I would like to know Tulips Corner. The, the let me see. Someone is, let me call someone. Call someone here. Hmm. Now, We have said management principles are three principal management. When you want to manage issues concerning menopause and menopausal syndromes, we sorry about that. Yes, we will manage it in three ways. So, so whether tukimaliza, yes, hello, yes, online. Okay, so yes. Now we will. Sorry about that. Sorry. We will manage it through three pillars. Three pillars meaning biological, psychological, and social. Biological, psychological, and social. Biological meaning hormones and brain chemistry. Biological meaning hormones and brain chemistry. And then psychological, this one is social. It's kind of like social, but it's not social. It is coping, cognition, and behavioral. When you think, how you cope and how you behave, that is psychological. And then we talk about social involvement, relationships, and environment. Those are the three pillars: biological, psychological, and social involvement. You see, but best outcome comes combining all the three, not using only one. You see, when you want to work on something to have a good outcome, you should always work with the three pillars of management. Here we are dealing with three: biological, psychological, and social. Now, step by step, how do we go about it step by step? Now, today we'll go slow because the crisis is always a problem, but how to solve it is the big tension and the big load that we have. So I'll go step by step on how to manage it because it's something that has destroyed and disturbed so many people. Blessings to you. This is Jamaican uncle from the UK, US, Jamaican uncle from US. Welcome to the platform. Now we have tulips corner. Tulips corner. Tulips are flowers. It means tulips loves flowers. Tulips loves flowers. Beauty is always beautiful from South Africa. Yes. Now, comprehensive and mental assessment. The first thing you need to do, the step one, when someone is at that crisis, menopause crisis, is comprehensive and mental health assessment. You assess symptoms like depression, low mood, and anhedonia. You assess this. King Ray, welcome, welcome. I see you there. You assess things like depression covering low mood and anhedonia. Low moods, shifting moods, anxiety. Sometimes the anxiety is displayed by people that are restless and panicking every time. So if you notice that someone is always restless and panicking every time, you should find out what is the problem. Check the age and check the transition. Is it pre or menopause? If it is pre, just know there is hormonal problems. Sleep disturbance. Some people have sleep disturbance. Wake up at 3. You sleep at 6. You wake up at 11. Hmm? Insomnia, a very big problem when it comes to hormonal imbalances, especially serotonin, GABA, and DOPA. Those are the main drivers of sleep. So when you have melatonin that is not being driven by serotonin, you will be having problems when it comes to sleeping. So let's check and see how we can move around this. Now, we have another thing called cognitive issues, brain fog. You start forgetting every time at the age above 45. You start forgetting. Now, you remember our talk about the physiology of this, the Sandra. Yes, I see you, Sandra. Sandra, welcome. Now, you remember what we talked about the follicle stimulating hormone and luteinizing hormone, because now the estrogen that is coming out is depreciated or suppressed. the follicle stimulating hormone and luteinizing hormone comes out so much, and then your brain balance loses, and then what happens, you start having fogged brain. Something that you've just talked a day ago or 2 days ago, you forget it, you start searching it, before you remember that thing, it has taken time. This is because of the serotonin, GABA, and DOPA that are not balanced. Irritability and emotional reliability. That one we talked about. Now, the comprehensive management lies between the cluster of assessment of mental health, depression, anxiety, sleep disturbance, cognitive issues, that is brain fog, and irritability and emotional irritability. Those ones are the ones which you should look at when you are assessing. Severity stratification is very important. Is it mild, moderate, or severe? Are you undergoing a mild situation, moderate, or severe? Now, when it comes to mild, you will find some occasional symptoms. Hmm? This one only needs some lifestyle plus therapy. When it is mild, a lifestyle and therapy change. And there is moderate, which is functional impairment. Functional impairment is when now you are forgetting, you are irritable. If you are being asked something anytime, anything that is simple, you want to burst out. You see, this one is a functional impairment. Therapy and medication is very important. Medication meaning pharmacologic medication, not medicating yourself. Pharmacologic medication. Severe, major depression and panic. Some people have major depression and they panic. You've met these people. This one is where you need medication and special care. Medication and special care is very important when it comes to this situation. There are three. Severity and stratification is based on three: moderate, mild, and severe. Now we have excluding medical mimics. There are some things you really need to exclude when it comes to assessment, because you may be assessing someone and you think this one is menopause, but a person is undergoing hypothyroidism. So before you start the management, you have to do blood works, like you rule out hypothyroidism, you rule out anemia. You see, anemia, this person might be undergoing some form of cancer. People that have sickle cell have problems when it comes to hormonal balance, mostly when it comes to advanced ages. Check on some social issues and protocols and programs that this person has undergone. Maybe this person 10 years ago was undergoing a social program because of major depressive disorder. And now she has come back. You think it is normal menopause, but it's not. It made me MDD. So rule out these things: thyroid dysfunction, hypothyroidism, Cushing syndromes. You rule out all of them by doing blood works, not by asking. Going to the hospital, do the blood works, rule out all this. Then come down to your impression, which is menopause. Then we start managing it. It's very important. Go, Daisy. Daisy is from Zimbabwe. Welcome, welcome, Daisy from Zimbabwe. I see today you are here. It's very important we learn together and associate. So if you have a question, drop it to the platform, we discuss it, because discussion helps a person to learn more and even learn how to handle some things that you don't know. Now, there are some things that you can help a person with that are non-pharmacological. That these ones you don't need drugs. Mostly when it is mild or moderate. When it is mild and moderate, some things you don't need drugs. You don't just give someone drugs because you think this person has a problem. Sometimes you need to use non-pharmacological ways. Mm? And pharmacological ways means the way the mechanism you use by not using drugs, oral drugs from doctor's office or the pharmacy. Now, correct, the first one is cognitive behavioral therapy. When we started mental health some times ago, we talked about cognitive behavioral therapy, how a person should behave, and how a person should correct the most negative behaviors. Why is it central? Cognitive behavioral therapy is everything when it comes to the right topic for my age, Dr. Ben. Very informative. Yes, welcome, good Daisy from Zimbabwe. I think you are noting and getting the notes down so well. Now, you cognitive behavioral therapy. How do we go about it? Why is it central? It is central, it's the most important thing because your behaviors are the ones which are guiding how the hormones in your body will be released. So correct negative thought patterns. Negative thought patterns, they reduce depression, anxiety, panics, and sleep problems because the negative thought patterns will always release some things like serotonin. Dopa will not be there. You remember, dopa is the pleasure hormone. It will not be there. And that one will spike a storm in your brain of hormones that are not working well. Yeah? Specific menopausal targets is catastrophic thinking. Catastrophic Lizzie Ash is here. Catastrophic thinking is when you are thinking of not making it. I think I'm losing it. You're telling people I think I'm losing it. If a person comes and tell you, I've been over this for so long and I think I'm losing it. This is where we talk that that person is having a catastrophic thinking. Eh? Health anxiety, misinterpreted hot flashes. You get neuropathies and then you start having thoughts that I'm not okay, and I think the next moment I'm gonna die because of hot flashes. Maybe you start thinking people that have diabetes always have uh, neuropathies. Neuropathies is burning feet and arms. So you at that point you are saying yes. Even me, I think I have it, and you will find that these people, most of them, they go to hospital thinking that they are very sick because they have the same symptoms that some people, like people that are hypertensive and diabetics, they share the symptoms. So you start having the catastrophic thinking of losing it in life, which is not okay. So here is where cognitive behavioral therapy is very important to do away with depression, anxiety, and sleep problems. So you see, very important cognitive behavioral therapy. So if you are here and you have been thinking of losing it, just know you are not okay. You need to join a group somewhere. Yeah? We go to mindful based stress reduction. We call it MBSR. Mindful. When you start from cognitive behavioral therapy, you go to mindful based stress reduction. How you can reduce amygdala overreactivity. You remember amygdala, the part of your brain that helps you to balance some things. Yeah? Reduce amygdala overreactivity. When amygdala is overexcited, you will go to depression. If you don't know what amygdala is, there is a part of, you go back to our last topics, you will see. You will see what we discussed when it comes to amygdala. Improve emotional regulation. This is mindful based stress reduction therapy. Mm? You see, when you have mindful based stress reduction therapy, this is what you get. Anxiety is reduced, irritability is reduced, and stress tolerance is increased. When you have a lot of things that are stressing you, you can cope up with them. So you are helping your amygdala in your brain to know how to balance. This is amygdala is a part of your brain that increases your stress tension in the brain and releases some hormones that makes you be so complicated and irritable every time. So the mindful based stress reduction technique is a very important technique, because if your anxiety is reduced, irritability is okay, and you have stress tolerance, some hormones like serotonin will not be released. And you see, when serotonin is released, that's when you start getting into depression and you start telling people, I'm losing it in life. Now, we have the other one, which is behavioral activation. Behavioral activation, that is the third one, used in depression. You know, we are talking about mental health when it comes to menopause and post-menopausal periods. Yeah? Behavioral activation. Encourage structured daily activities. You are programmed, when I'm waking up, the next thing I'm doing is this. I'll go to my farm. I have to do this after office. I want to do this in the evening at 6. I'll be in my house, I'll be doing A, B, C, D. It makes you forget, and the pattern makes you increase dopa in the brain. The amygdala is suppressed, and you increase something called dopa. So dopa is, when it increased, it gives you pleasure of doing whatever you are doing. But when amygdala is overreacting, you start having stress. So when you have behavioral activation, like encourage structured daily activities, what you do is you are suppressing amygdala and dopa is activated. You check it out. Reintroduce rewinding experiences. Break the depression inactive circle. Reintroduce rewarding experiences. The experiences that you think were good and you are rewarded with them. You see how we manage things here. This is non-pharmacological. We are not using any drug to manage whatever crisis you are undergoing. We are not using anyone. Here we have, I will repeat, cognitive behavioral therapy, mindful based stress reduction, MBSR, and the first one was CBT. And then we have behavioral activation. Behavioral activation is you structure daily based duties that you will be doing every time. You check it. It's very important, and it is very important to follow up these things that we are talking about. We have another one which is called behavioral activation, and then we go to the other one, which is psychoeducation. Psychoeducation is very important. Hello, Roger Skillia. Roger Skillia, welcome a lot, and thank you so much for the last video that you did. It was so nice. We were so excited. Nice. Psychoeducation. Explain to the patient. Explain to the patient. Symptoms are hormonal plus neurological, not weakness. It is not a weakness. Brain changes are temporal and manageable. So a patient may say, my brain is losing it, but you can tell this patient that these symptoms that you are undergoing, these symptoms are hormonal and neurological, but brain changes are temporal and you can manage. You get it? This is the most important thing, psychoeducation, helping the patient to cope up with whatever he is undergoing. The first step of healing is accepting and trying to change. The first step of healing is acceptance. Sleep focused intervention, non-drug. You sleep, fixed sleep schedule, not watching, because now you love watching. You start watching a lot of Margaret, Dr. Ben. Hi, Margaret. Hi, hi, Margaret. Kish, kish. Well, hey, happy sleep, everyone. Yes, Kish Kish has retracted the message. Kish Kish, that is important. Happy sleep, everyone. Structure time where you need to be sleeping. From 8 hours or 6 hours is very important. You know you are undergoing an hormonal crisis. So sleeping helps you to balance the sleep pattern. See that? Now we have another one which we call psychological focused intervention. Yeah, that one is very important. Sleep improvement measure it improves mood, mostly when you have enough rest. It improves mood. Fix sleep schedule, avoid screen time before bed, cooling environment. Before bed, you don't need to be on screen. You watch the screen until you doze on your sofa. Hmm? As you watch the screen, some hormones are being excited. And when they are being excited, you have the problem because now, for a woman, we've talked about a woman, the follicles are withering, estrogen is not there, inhibidine hormone, which helps to balance some hormones, is not there. So you are watching screen time for so long at night until you start having overwhelming release of some hormones, and amygdala is the part of the brain which we call the amygdala starts to overreact. It will overreact until you start feeling stressed. Have you ever stayed um, up at night watching? You feel tired and fatigued until the next morning when you wake up, you feel you're feeling tired and stressed, and you don't know what the stress you have. And this is why nowadays so many people are undergoing tension and stress at an early age. More screen time and more media time on gadgets. You get it? You should have a programmed uh, schedules of gadget time, because the more you are on gadgets, the more you are killing your making your amygdala in the brain active. It is very important at these ages that you balance screen time and associations. I, physical activities are more important when it comes to releasing and balancing the hormonal issues of your brain. Physical activities, not gadget activity. Gadget activity, I mean laptops, computers, televisions, media, media issues. You get it? Tension. So I'm talking about those people that are at and premenopausal and menopausal. So you, as you are young as you are, most of the time you spend more time watching overnight until one day your hormones are started to fluctuate. You get it? You've seen so many young people that are depressed because of taking their more time on social media and gadgets, because now you use a lot of time on social media and gadgets. The media that you are watching is not the one which is giving you the stress. It is not the one which is controlling what you are undergoing. What is controlling what you are undergoing is the time that you are using your optic nerve, and then it becomes stressed. Some hormones in your body starts to activate the amygdala, and then the amygdala itself makes you go into depression. Miriam, welcome Miriam. So most of the people say that the media has destroyed the generation, but what has destroyed the generation is the imbalance of hormones that are in your brain. And we said those transmitters, they are called neurotransmitters like serotonin, GABA, and DOPA. If you stay so much on media and gadgets for so long, like for 3 days you are watching, well, people say we are Netflixing, I'm just on TV the whole day. Uh, GABA itself will not be released because now you're not having that pleasure hormone at work. Serotonin itself will not be at work because now it has no role to be released. And when your brain senses that you have no role to release it, it shuts down other functions. Pituitary gland stops to work temporarily. The amygdala is activated. Then you start sensing some depressive disorder in a way that you are not in depression, but because your actions have started giving you sense of depression because of the imbalance. Please remember, yes, 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 Rogers, please. That is very important. And share also, it's very important. Your actions starts to make an imbalance in your brain, and it starts to destroy some tissues, pituitary gland, amygdala. You get it? Hypothyroid, parathyroid. Then we go down to the follicles and the uterus. That is how it comes. Now, I'm talking about a young age, a person of a young age. Now, because of your actions, you start having irregular menses at an age that is so young. Before you reach free at 45, at 40, you have all these crises. So let's help our young generation to be active on physical activity rather than gadget time. It is very important we know that. It's very important we give the physical activity more time rather than gadget time more time. More gadget time, I've said, is what you are having right now, what you are using to listen to me right now as you take notes. You get it? So that is what we usually say. The sleep focused intervention, psychoeducation, and then we have mindful based stress reduction therapy and cognitive behavioral therapy. They come in to help you to change from what you are doing to do the right thing that is supposed to do. Physical activities are very important, and these are the main uh, when it comes to menopause and postmenopausal, they are the main therapies, even not drugs. But you see, you will find that it comes to where now the therapies have lost and you have a crisis. That's where we go to pharmacological management. This is where now we bring in drugs. Drugs that, and you know, the drugs that we use are just antidepressants. And the antidepressants themselves, they only stop the hormones that we talked about from reacting and coming out. Antidepressants like first line moderate severe symptoms, we use serotonin inhibitors, serotonin reverse inhibitors, fluoxetine, like fluoxetine. You see, when serotonin comes out, because it is something that is it's supposed to make you feel better. When it is more, it makes you feel happy. When you start having the mood swings, it reduces. So we give you fluoxetine or sertraline so that it is not reversed to go back. You still have it. You see, this is just a way to stop the the signaling pathway to continue working. The signaling pathway is the neurotransmitters, the serotonin, the dopa, and the GABA. So for me, I usually think psychoanalytic therapies are better than pharmacological management, because pharmacological management only comes in. You know, you cannot survive with drugs alone. You need to help yourself to balance those hormones. Hmm? So that is antidepressant, and then we have serotonin inhibitors like valsartan, val, valafloxacin. Valafloxacin is also another antidepressant. It also reduces hot flashes. It is called SNRI, serotonin reverse inhibitor. But I don't like these drugs. As much as we have these drugs, we should always use behavioral activation, mindful based stress reduction, and also cognitive behavioral therapy. Get it? It's very important when it comes to management of these symptoms. Very important. But you should not just use drugs. When do you use this drug? Because there are some signalings that may come to show you that no, where I am now, I need to use drugs. Hey, today people are so listening and so quiet. No questions. Eh? Please, if you have a question, drop it as we continue. This is this topic. I'm ending it today. Next week we are starting with cardiology issues of the heart, blood system, and the arteries. Cardiology, complications of the heart, and so next week. So, if you have a question concerning this, please break it down today. Bring it down today. We discuss it. We have said you should just not start using drugs. These are the signs and symptoms that need when you should start using the drugs. One is persistent depression, always on depression, anxiety disorders, and sleep disturbance with mood symptoms, always changing moods. When you're changing moods, always it seems you have a problem when it comes to production of serotonin and dopamine. Now we can go to other ways like hormone replacement therapies. Now these ones are done in hospital with a practitioner who is licensed. You know, when you do hormonal therapy, replacement therapy, you are restoring estrogen. And when estrogen is improved, from the follicles are withered, but we are giving you now the estrogen that the follicles were supposed to be giving out. The serotonin is improved, you will get enough sleep and mood. So when we give you the estrogen itself, instead of now the follicles bringing it, you start having the normal balance. But you see, this one, it only means that you are being given artificial estrogen, a hormone, like you give it as a drug, as a drug. But when you try to balance yourself with psychotherapy, that is very important. But indications of hormonal therapy is early menopause, prominent vasomotor plus motor symptoms, mood symptoms. You have neuropathies, burning sensation, hot flashes, mood irritability. Now this is where we think of hormonal replacement. And now it comes out with even headaches, and headaches comes out with stress disorders, depression. Hmm? This is where we think of hormonal replacement therapy, because we don't want you to do what? To go into a crisis. A crisis can be bad. But you remember another thing, hormonal replacement therapy is not done to people with breast cancer and or thromboembolic diseases. Diseases like uh, breast cancer, they will, if you give estrogen, it will make this person to go to the advanced stage, because estrogen supports the growth of mammary glands and the factors, the factors of a woman being a woman. And now this woman is having uh, breast cancer, and you are giving more estrogen, you will give this person a problem. Diseases of bleeding, thromboembolic diseases, we don't give estrogen because this person may be bleeding for long. But you can give anxiolytics for short term. Those drugs that helps in a person when a person is anxious, like severe anxiety, panic attacks. Avoid long-term independence, but just short-term when this person is having a panic attack. Sleep medications are important, but me personally, I don't give sleep medications. Herbs and spice, greetings, welcome, welcome. I don't give unless it is once and it's in crisis. Hello, Benjamin White Guy, and everyone. That is Christine Long from UK. Yes. Now, those are the important medications that can be given at pre and post, not post, at menopause. Because at post, you have already made it and you are stable. So there are some cognitive symptoms management like fog. I said fog is whereby you are at menopause and you start forgetting. You talk right now something you have discussed with you, and then after 2 weeks or 2 hours, you start finding the word to tell me, or you want to tell me something, but you are really searching for the word that is you want to tell me. It is called brain fog. Brain fog, the strategy is cognitive training. You start giving yourself tasks. When you give yourself tasks, when you are cognitive training yourself, you will not get forgetfulness. I know so many people forget every time. Every time you have just done something and then you forget. You start thinking, what can I do to remember that word? And then after 1 hour, you remember it. It is cognitive brain management, and this one is fog symptom. Hmm? Adequate sleep helps when it comes to fog symptom. Regular exercise increase brain plasticity and stress reduction. Stress reduction. When things are not working out, just say all is well. Let me find a plan B. Let me find a plan B. And when I'm talking about this one, cognitive symptoms and brain fog management, I'm saying that you should not be dealing with something called dementia. Rule out all the causes that all the symptoms of dementia and remain with menopause. Mm, please, you may be dealing with dementia and you want to deal with it as menopause. It's not okay. Rule out. You get it? There is something called social and emotional intervention. Social and emotional intervention. The support system, family involvement, peer group support. You see, some people are undergoing when you've been having someone in a relationship for so long, years, and you start having these problems, and then this person looks at you like this, like nowadays you have changed. Of course you've changed. It is transition. And then you start having problems saying that nowadays you have changed, you are not the way you are now. You Yes, your partner should know that you have changed and you need support. You need support to overcome this. Hey, Leila is here. Hey, Leila, welcome, welcome, welcome. You need support because all the hormones are at storm. It is pre-menopause and menopause. Your partner a man goes and discusses with the friend that, hey, nowadays I can't sit even at home. Hmm? Everything has changed. I'm being looked at as if I'm a stranger. You should know things have changed. It's a transition, and you should be in that house to help whatever where you can so that things can be normal. But you see, I don't blame everyone because some people don't know that this is a transition. But if they are given the information, like you who is listening to me, and give them the information, they will know and they'll know how to handle. So family involvement is so well. Give reassurance. Help this person to understand the position that she is. Mm. Sometimes when everyone is irritable, you don't get irritable. You support. You support. You keep quiet when the storms have risen because you know at a point the storm will come down. Get it? Be a supportive partner. If you someone doesn't have a partner and people are around these people, uh, you should always be there for them. And the person who is undergoing should form a peer group where they can be discussing. Join a group where you can be discussing and helping each other to cope up with some symptoms, to come up with a strategy that can cope up with some symptoms at this strategic period of menopause. Hmm? Relationship counseling. Relationship counseling is important. Helps with sexual health concern. Do you remember we said now it is a transition period and the GABA and DOPA is not there. The pleasure hormone has gone. So someone looks at you like this as the brother, hmm, as the sister, and you start feeling bad. You start feeling that I'm not supposed to be going through this. My friend, you will undergo through that because you picked, and it is now time to give back. Understand that the hormones are not there. This person is not undergoing the pleasure as the she was having sometimes ago. You check it out. So relationship counseling is important. Let them understand that things are changing, and at this particular time, whatever that they were having when they were young is not there. You know, men at times they don't age faster when it comes to these things, relationship, and that's why men sometimes they marry people younger than them with 30 years. Because now, because you are at 45 years, 50s, and these transitions are there, you want to go back to experience what you were experiencing 20 years ago. No, you can experience it right there by understanding and bringing back the aura, helping your partner to cope up with the symptoms of menopause that she is undergoing. You get it? It's very important about that. The emotional disconnect can come back if you are a supportive partner or the friends that are around you are supportive. Now that we know it is not only physical or character wise, it is from somewhere. It started from the uterus and the follicle withering and estrogen going down, and the brain became. We know now it is not character, because a person may judge someone because you say your character nowadays has changed. No, it's not character, it is physiological. It is something that needs help. Hmm? Relationship counseling, very important. Role transition support. Role transition support. Yeah. Oh, sorry. Yes, role transition support. Role transition support is very important. A minute, I check this out. Fluoxetine, yes. Now, there is a transition between when you see the doctor, this serious, the topic is serious too. When you Leila, yeah, Leila is saying today I'm very serious. Topic is serious, yes. It is serious because it makes families break whatever that you've created as resources from, yes, Agnes Thomas, welcome. The resources that you've been creating for the last 40, 50 years with someone may be destroyed between this period when someone is not understanding. You get Leila? It is serious. It's a matter that many women are undergoing and they are not taken serious and they suffer inside in silence. You get it, Leila? They suffer inside in silence. Mhm. So, as we speak right now, we should know how to undergo these issues and help. We have talked of cognitive behavioral therapy, we have talked of psychoeducation, psychotherapy, all these, uh, cognitive behavioral therapy, sleep restrictions, stimulus, relaxation and training, mindful based stress reduction, all these. But you see, having a supportive and counseling group or family or partner helping you beside, it is very important. It helps you to bank and balance on some issues. It helps you to have the courage to undergo and move forward from this period. Hmm? Some marriages break at this, and some people may ask, why are some people divorcing at a very old age? This is the period that some of the divorce happen because one partner, who is the man, does not understand what is going on. Mostly in, not even in African society, even abroad, enlightened society, a person has not gone to cognitive behavioral therapy, you are not even visiting a counselor and you don't know what is happening, you think you are right, you start saying someone's character has changed. This is where it brainstorms and people separate. That's why today I'm going so slow and I want people to understand what I mean, because you can help someone's marriage and life. But you know, marriage of 50, 45 years is not just a marriage. That one is like a group of things. You have children, you have resources, you have everything. So you separating means problems for many people. So let menopause not separate people. Let's understand menopause and let's understand how to cope up with this. Hmm? We have said lifestyle psychiatry, exercise, which increases serotonin for you to be happy, endorphin, neuro, psychotic, brain derives neuro, psychotic factor. There are some things like endorphin, serotonin, and brain derives neurotrophic factors. When you are exercising, they increase. Hmm? They act like natural antidepressants. They are natural. When you are exercising, when you go to the gym, you come back home and you are okay. You feel relieved because endorphins and serotonin are released and you feel better. Sleep optimization, we have talked about it. Nutrition, always take omega-3 fatty acid foods. You eat fish and you want to eat the fleshy part. Always eat the head where the omega is to make the serotonin and the other neurotransmitters to be on course. Get it? Vitamin B, especially B6 and B12, and magnesium, your memory, nutritional care, and vitamin Bs, they help when it comes to burning sensation of your feet and burning sensation of, it is called tingling sensation, paresthesia. When you feel the hot flashes and the burning sensation, always take vitamin B12. It will reduce. If you are here and you are undergoing that, vitamin B12 is a very good supplement for you. You get it? Magnesium too. Stress management, yoga, mediation, and deep breathing when it comes to some things is important. Hormonal management, hmm? Hormonal replacement therapy, we have talked about it. But now there are situations that you cannot use hormonal replacement therapy because you have maybe a cancer breast, you are a patient, previous patient of a breast cancer that healed, or you are undergoing bleeding disorders. Your doctor will tell you if you need breast replacement therapy or you don't need it. Hormone replacement therapy, very important. Not everyone gets it, not everyone gets it, but the best candidate of this is early menopause, prominent vasomotor symptoms and mood changes. Early menopause. Pharmacologic, we have talked about it. We have talked about the drugs you can use. That one we leave to professionals. When you go there, you write. Anxiolytics, sleep mediations, adjuncts like melatonin and magnesium. Melatonin will help you to get sleep. Now, management by syndrome. Today I'm going slowly. I want people to understand how to manage these things. Management by symptom. If it is depression dominant, you go to cognitive behavioral therapy, the way we have talked, and use drugs. If you are displaying with the symptom of menopause plus depression that is seen, behavioral therapy, and drugs, antidepressants, serotonin inhibitors and non-serotonin inhibitors. Anxiety and is dominant. You panic every time. You are breathless, always anxious. Cognitive behavior therapy, relaxation techniques, and drugs are very important. Very important. Now we have the other one, which is sleep dominant. You want to sleep. You want to sleep. Oh, Margaret in Norway. That one is anxiety dominant. Eh? You talk to me privately. I think Margaret in Norway. Christian Long, you are a content creator. Christine Long, Christine Long. Let's go to see Christine Long. Christine Long, yes. If you have sleep dominant, that one you don't need to use drugs, only cognitive behavior therapy. I sweat a lot. Someone says she sweats a lot. When you sweat a lot, you need to check your thyroid function. Thyroid function at that level is important. Please check Daisy thyroid function. Cognitive symptoms like brain fog, forgetting every time, exercise, cognitive training, and sleep optimization, and those ones are very important. Exercise, cognitive training, and sleep optimization. This happens when you have brain fog, forgetting every time. Now we have step 7, which is social and psychological intervention, family involvement, educate partner and family. So that the partner cannot start saying the character has changed. Partner should know there is a problem that is medical and it should be addressed slowly by slowly. And improve support system. Yes, CJ Rehab. I see you, CJ Rehab. Welcome. You see how I'm going step by step. That is the way you should handle these things step by step. Social groups, join a peer group, join a community, be in a community engagement group. Role adjustment, help patient redefine identity. Now you are not a young person, you have shifted to another group. Hmm? Avoid the people that tells you are sweet 16. Embrace now the title of being a grandma. Address aging concern. You see, I'm trying to address the aging concern. There are some people who don't need like addressing the aging concern, and it becomes so complicated. It becomes a problem to a person. Hmm? Yes, you start embracing sweet 60. That is Leila. Very nice, very nice. Yes, very important. Hmm? Help patient redefine identity by knowing age has advanced. Step 7, management of severe cases are done in hospital. Severe depression, suicidal ideation, functional impairment. Hmm? Now, management urgent when it is you find that a person has severe depression, suicidal ideation, and functional impairment. Now that one needs a psychiatric referral, combination therapy, and close monitoring. And then we just don't live there. We have long-term follow-up on mood improvement, sleep quality, medication, adherence. Because someone may be given drugs, but does it come with hair loss too? Yes. The more you lose your melatonin, the more your hair goes down. And even the hair color, Leila, changes. Even the hair color changes. So it comes with hair loss. Hmm? So high yield summary, first line, let me just summarize before our time is up, our time is out. When it's first line and I'm undergoing this is now I'm at pre-menopause. First line is cognitive behavior therapy and lifestyle modification. Moderate, but when it is moderate, ndio maana niko na kipara. When I'm serious, Leila always makes me laugh. Leila is is a funny guy. Moderate, when it is moderate and severe, you use some antidepressants. But when it is having moderate and some what flashes, they are called vasomotor issues, you consider therapy plus the cognitive behavioral therapy. Always rule out organic causes. Always assess suicide risk in depression. Manage must be individualized. Don't generalize any treatment when it comes. So, we have talked about the 7 steps. I will go slowly. If you are noting them down, note them down because these are the most important steps when it comes to management of these problems. One, the foundation itself, which is biological, psychological, and social. Biological means estrogen has declined, psychological coping ability to the people is not there, and personality changes. Social relationship disturbed. You first assess. You get it? Second, step one, you assess mood, anxiety, sleep, cognitive, energy, and libido. You get it? Number three, we use drugs. We don't use drugs. There's non-pharmacological things we can use as first line, like psychoeducation, psychotherapy, mm, psychotherapy, and cognitive behavioral therapy. Yeah? Mindful behavior and stress reduction, interpersonal therapies. You get it? Lifestyle psychiatry. That one we have talked about. Let's not repeat. Number three, step three, hormonal management. Hormonal management by hormonal replacement therapy. You get it? By hormonal replacement therapy. Step four, pharmacological psychiatric management. This is where we bring antidepressant like fluoxetine and sertraline. And then we will go to step five, management of syndrome by syndrome. We have talked about cognitive behavioral therapy plus serotonin inhibitors, which are antidepressants. This is when you have depression. When you have depression. When you have anxiety, we don't use drugs. Cognitive behavioral therapy is where we use. When you are sleep dominant, you like sleeping a lot, you use only cognitive behavioral therapy without drugs. When you have cognitive symptoms like forgetfulness and brain fog, exercise, cognitive training, and sleep optimization is important. And then number seven, we have said social and psychological intervention, family involvement, and Barbara, welcome, Barbara. Family involvement, and what else? You educate the partner by taking to a professional to tell the partner this is what is happening. You get it? And even social support and role adjustment. You get it? Now, there is management of severe cases when you find that there is severe depression, suicidal ideation, and functional impairment. That one is done by professional. We do follow up long term, and sometimes we high yield. We follow up and we give medication or we remove medication. You get it? So that is the proper management of the symptoms that we've been talking about, the management of menopause and premenopausal. Now our time is out. Anyone who has a question, I'm giving 5 minutes, 5 minutes for everyone. Anyone who have a question. so that I can wrap up. We start cardiology next week. Matters concerning blood pumping, matters concerning the heart, matters concerning dysfunctions of the heart, matters concerning problems that involve the heart next week. Today is on Sunday. Anyone with a question? Barbara's World. Hi, I'm here. I'm wrapping up this topic. I'm here. Anyone with a question? Yes. Don't worry, but you can still rewatch and learn and make notes. Anyone with any question? I'm waiting before I go out. With menopause, anything or any medical question from the topics we have gone through. Anyone who may have any question? Leila have said today I'm very no question, but it's all happening to men too. Yes. That is a question. That is Leila. Leila has told me no question, but this does this happen to men too? Hmm? What do you think, Leila? What do you think about that question? Anyone who can answer that? Does menopause happen to men too? Now, we when you start selling liquid Roger Skiller, soon you will start selling liquid soap. Now, what do you think? Oh, I had so. Yes, Kish Kish has said she had so. I think happened hapo kwa mood swings. Hapo kwa mood swings. Yes. When we started menopause, we started saying the follicles and the uterus withering. So men don't have the follicles and the uterus. Ah, yeah, Christine Long. Yes, some men can be menopausal. Yeah, you guys, you make me feel better and I'm serious, I think. Yes. You see, for women, it starts from the follicles, so it is menopause. For men, it is called andropause. Think we will do andropause one day. Men do not have true menopause. No, they don't. But they develop a condition that it's called andropause. Andropause, also called late onset hypogonadism. Late onset hypogon. Yes, andropause. Late onset andropon. That one, Christine Long. The sperm cells finish just like egg cells. Yes, no, we will talk. Please do andropause. I see details. I will talk about andropause today night or tomorrow. I think it's that one people are really need to know because my time is out right now. We'll talk about andropause, but you see, just as the follicles, they can be till they are they can reproduce till they are 100. That is Leila, Leila, our funny sister. Now, you see, as you age, some organs and some organs wither out, just like menopause, where the uterus and the follicles starts to wither, and then menopause peaks in. We have andropause, which is for men, and we will discuss about andropause. Andropause is a very funny thing. It is like menopause in women, but you see, strategically, the women are the ones which suffer a lot because they produce and they are expected to behave in a way in a society. But men, you see, andropause mostly is not noticeable. Andropause is not noticeable. I'll talk about it, although it's not a big topic. I'll bring it. I can talk it about our crisis time at 10 at night. So, any other question? I think that one I've answered it, but I'll do it. I'll do it so that people can understand what andropause is. I'll do it. Any other question anyone has before I log out? That was a question, Leila. That was a question. That was a nice question, and I think it has brought in another topic which we will cover. I know a man who was 100 years but had babies yearly. That one was being assisted by someone, Leila. That one was being assisted by someone. Andropause, I'm learning. Yes, 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 andropause. We will talk about it. It's a very intense and good topic, although it's not long like menopause. I bet you mind life crisis is big part of agropause. Andropause. CJ Rehab, it's called andropause. I bet you my life crisis, midlife crisis. You're talking about midlife crisis being part of andropause. Oh, okay. Midlife crisis is totally different from andropause. Grand rising everyone's under interesting topic. So I see most questions have gone. We will Benjamin, no. Rogers, okay. I see that. I see that. I see it's an andropause or agropause. It is called andropause. Let me pause. It is called andropause. Andropause. Androgen means andro means tissues. Pause means to stop. So andropause means tissues stop. Andropause. Andropause. Like that one. Who is this? Yes, Christine Long, thanks. It's not my accent, it is the way you are listening. Kilia, it's true that man was an Arab. The babies were Arabs and it was in the village. Okay, okay, I will see about that. As we study, we will see about that. You know, I cannot overrule. It may be okay. I have a good accent, CJ Rehab. I have a good accent. And now you know it's not agropos. You are the one who is listening to yourself. It is andropos. Now, guys, I have to go. Let's meet at 10. It's a short topic on andropos. 10 East African time. 10 East African time for that topic. We want to clear everything on these menopause and aging issues before we start. We start on cardiology issues. Okay, bye. See you everyone at that time as we discuss matters concerning andropause. Andropause. Bye everyone. See you. See you.